স্বাগত বেস্ট স্কুলে। Today our study topic cardiovascular system. Function of cardiovascular system. Transport important substance around the body. Main component of cardiovascular system. Number 1 heart, number 2 blood vessels, number 3 blood. Heart. Heart is the main organ of cardiovascular system. Its main function pump the blood. It situated left side of the chest. Heart is covered by pericardium. Layer of the heart. Heart has 3 layers. Those are epicardium, number 2 myocardium, and number 3 endocardium. Chamber of heart. Heart has 4 chambers. In receiving chamber, right atrium and left atrium. In distributing chamber, right ventricle and left ventricle. Valves of heart. Valves control the blood flow in the heart. Heart has 4 valves. Those are number 1 tricuspid valve, mitral valve, number 3 aortic valve, number 4 pulmonary valve. Heart rate. The number of heartbeat per minute is called heart rate. Normal heart rate for adult 60 to 90 beat per minute. Average heart rate 72 beat per minute. Tachycardia. Fast heart rate than the normal. Usually 100 beat per minute. Bradycardia. Slower heart rate than the normal. Usually 60 beat per minute. Blood vessel. Blood vessel are hollow tube that carry blood to the tissue and from tissue to heart. Type of blood vessel are number 1 artery, number 2 vein, number 3 capillary. Artery carries oxygenated blood from heart to all over the body. Vein carries deoxygenated blood from all over the body to heart. Layers of blood vessels. Blood vessel layer are number 1 tunica intima, number 2 tunica media, number 3 tunica adventitia. Circulation. Circulation is a process by which blood flow continue to the blood vessels. Circulation are 2 types. Number 1 pulmonary circulation, number 2 systematic circulation. Blood pressure. Blood pressure is the lateral pressure which is exerted by the blood on the wall of blood vessels. Normal blood pressure 120 to 80 millimeter of mercury. Type of blood pressure are number 1 systolic pressure. During contraction of the heart. It is less than 120 to 139 millimeter of mercury. Number 2. Diastolic pressure. During relaxation of the heart, it is less than 80 to 89 millimeter of mercury. Cardiovascular disease related to heart and blood vessel. Number 1. Hypertension. Number 2. Ischemic heart disease included angina and myocardial infarction. Number 3. Deep vein thrombosis. Number 4. Infective endocarditis. Number 5. Atherosclerosis. Number 6. Phlebitis. Hypertension. Persistently elevated high blood pressure than the normal is called hypertension. Its cause genetic, smoking, overweight, high lipid content. Ischemic heart disease. It has two subtypes. A. Angina. Angina is characterized by chest pain due to lack of blood supply of heart muscle. Myocardial infarction. Myocardial infarction is irreversible death of myocardium due to atherosclerosis in coronary artery. It is also known as heart attack. Deep vein thrombosis. It occurs when a blood clot or thrombus, one or more, are in deep veins, usually legs vein, most commonly calf veins. Infective endocarditis. It is the inflammation of endocardium. Atherosclerosis. Atherosclerosis when arteries become blocked by erythema. Phlebitis. Inflammation of vein. Blood. Blood is a connective tissue composed of plasma and blood cell. Blood সমান plasma plus blood cell. General properties of blood. Number 1. Blood volume average 5 to 6 liters. Blood pH value is 7.36 to 7.45. Number 3. Blood temperature 36 to 38 Celsius. Function of blood. Number 1. Transport function. Transport nutrients, oxygen and carbon dioxide, hormones and other substances. Number 2. Regulation function. Regulate of body temperature. Number 3. Defensive function. Provide defense against infection by WBC. Plasma protein. Plasma protein are proteins in blood plasma. These proteins are number 1 albumin, number 2 globulin, number 3 fibrogen. Blood cell. Blood cell are 3 types. Number 1 red blood cell RBC or erythrocytes. Number 2 white blood cell WBC or leukocytes. Number 3, platelets or thrombocytes. RBC or red blood cell. Its main function contains hemoglobin, which carries oxygen. RBC cell lifetime 120 days. There is no nucleus in RBC cell. Hemoglobin. Its main function transport oxygen and carbon dioxide. Normal hemoglobin count for male 14 to 18 gram per deciliter. Normal hemoglobin count for female 12 to 16 gram per deciliter. WBC or white blood cell helps to kill bacteria, virus and parasite. Type of WBC cell are monocyte, lymphocyte, neutrophil, basophil. Platelets. It helps to stop bleeding. Common blood disease. Anemia and leukemia. Anemia. Anemia is the condition in which the number of RBC or red blood cell become low or decrease of hemoglobin. Iron deficiency anemia cause low iron intake and loss of blood. পরবর্তী ভিডিও পেতে চ্যানেলটি অবশ্যই সাবস্ক্রাইব করে আমাদের সঙ্গেই থাকুন। তথ্যচিত্রটি দেখার জন্য অনেক ধন্যবাদ।